Hi class, my name is Bianca de Peña and my partner's name is Marcos Rodriguez, and today we will be doing a presentation on stress management. Stress is defined as pressure or tension extended on a material object, and it's basically the brain's response to any demand. There are three types of stress. These include routine stress, stress brought on by sudden changes that are negative, and traumatic stress. A body system that is constantly fighting stress may result in obesity, heart disease, depression, and a variety of other illnesses. Therefore, there are two stress management techniques that I will briefly mention that help individuals alleviate symptoms of stress. These are yoga and progressive relaxation. But before diving into the specific stress management techniques, I wanted to go over some definitions. Distress means bad. Damaging effects of this type of stress include but are not limited to high blood pressure, emotional disturbance, headaches, fatigue, and behavioral changes. Another type of stress is eustress, which is defined as positive stress that allows us to challenge ourselves, enjoy activities, and leads to improve self-esteem and confidence. When individuals are confronted with stressors, they decrease their leisure involvement in most areas except for relaxing activities. One stress management technique is yoga. Yoga is defined as a yoke or union. It is a connection of mind, body, and spirit into one. Yoga is primarily a spiritual discipline and is the oldest and most complete system of traditions and personal development that focuses on the mind, body, and spirit. Both Hatha and Raja Yoga are common practices. Hatha Yoga is associated with posture and breathing exercises that increase the flexibility of the body, mind, and static muscle strength. On the other hand, Raja Yoga is associated with the mind, meditation practices, and diving into the inner universe. Restorative yoga practices invites relaxation as the body is given poses combined with the use of blocks to release tension and relax muscles and the mind. The classes that are sequenced to move the spine in all directions and invert the body to reverse the flow of blood. Research has indicated that hormone levels dramatically change and fluid retention lessens after restorative yoga sessions. The second stress management technique is progressive relaxation. This is a method for treating individuals experiencing psychological stress and physical symptoms associated with stress. In this technique, participants are guided through a full relaxation session while seated comfortably in a recliner chair. Participants are directed to tense a muscle group, maintain tension for 5 to 7 seconds, and release the tense muscle. The order of tension and release is used for 16 muscle groups. Stress is historically associated with allostasis, or the flight or fight response, which was vital to the survival of our ancestors. Although those life-threatening situations are uncommon now in modern society, we continue to have those stress responses. References of yoga stem from the Bhagavad Gita dating back to the 6th and 3rd century BCE. The earliest indications of yoga practice are found in 5,000-year-old ceramics which were decorated with meditative postures. The first Upanishads were written 800 and 500 BC. These writings provide the central teachings of Hinduism, and Hinduism is described as having the largest literature of yoga and meditation. Yoga Sutras of the Patanjali was written in the 2nd century BC, the sutra guide for practitioners through various paths of yoga philosophy. Yoga in modern society can be traced to the Swami Vivekananda in 1983 at the Parliament of World Religions in Chicago. The growth of the Western Hatha started its popularity in the 1940s with Indra Devi opening a yoga studio in Hollywood, California. In modern day, reports indicate that 10% of adults participate in yoga industry. Yoga as a practice has become more accessible to the general public. The second stress management technique, progressive relaxation, was developed by Edmund Jacobson, who conducted studies at Harvard University in 1908. Jacobson went on to publish a description of his technique in the American Journal of Psychology in 1925 and reported on the culmination of his studies in a book, Progressive Relaxation, published in 1983. There have been numerous modifications, adaptations, and applications of this technique. For example, initially there were approximately 200 different muscle relaxation techniques. Many of those applications today use much fewer techniques, such as 20, in order to make the technique more usable.
Now, for this portion of the video, I will be explaining the theoretical foundation of stress management techniques. Now, theoretical foundation related to the values of stress management interventions are based on current knowledge of the body response to stress. Stress has many effects on the body and mind. There are two theories that describe how stress affects us humans. These two theories are psychological disruption due to stress and analytical introspection. We all know the feelings of our hands trembling and sweating when we get nervous to take an exam or have trouble sleeping while we worry about an approaching deadline. Stress is something that will always exist, and many people are affected in different ways. While everyone understands the symptoms of stress response, few know the underlying psychological mechanism of stress. Stress causes a psychological disruption that affects the body in a negative way. It makes your body's hormones go haywire and respond with a short term flight or fight action, which can become worse by becoming a chronic vigilance response. That this response triggers the pituitary gland and adrenal gland, which releases cortisol into the bloodstream and causes a lot of negative issues. Now, I will be explaining the effectiveness of intervention for three different populations. It says many studies have been conducted examining effects of stress management techniques. A great stress management technique is yoga. Yoga studies show that the most effective way in which yoga targets stress are by lifting your mood or positive effects, by allowing for increased mindfulness, and by increasing self-compassion. Simultaneously, getting us into a better mood enables us to be more focused on the present moment, and by encouraging us to give ourselves a break. Yoga is a very effective stress reliever. Yoga has shown great benefits for theoretical recreation professionals who assist individuals who suffer with anxiety, depression, and cardiovascular function. Yoga is an effective natural treatment for acute anxiety disorder and depression. Researchers have found that yoga may be superior to other forms of exercise in its positive effect on mood and anxiety. Daily practice of yoga, complete relaxation, and meditation is essential in the depression and anxiety disorder treatment. Since considerable evidence exists regarding the suitability of the yoga in dealing with depression and anxiety as a natural mind-body medicine. Yoga researchers have shown yoga can improve sleep disturbance, anxiety, and mental quality of life, having a direct, potent, and lasting effect on anxiety disorder symptoms. It says asana yoga techniques and meditation are two main techniques of yoga practice in India over thousands of years to obtain functional harmony between the body and mind. Recent studies on long-term yogic practice have shown improvement in cardiovascular function. 50 healthy subjects, 24 males and 26 females of 20 to 60 years of age group, fulfilling the inclusion and exclusion criteria, underwent 2 daily yoga training programs for 15 days by a certified yoga professional. Pre and post yoga cardiovascular functions were assessed by recording pulse rates, systolic blood pressure, and diastolic blood pressure, and mean blood pressure. There was significant reduction in resting pulse rate, systolic blood pressure, and diastolic blood pressure, and mean blood arterial pressure after practicing asana yoga and meditation for 15 days. The response was similar in both genders. This study showed beneficial effects of short-term 15 days regular asana yoga and meditation practice on the cardiovascular function.
So now Marcos is going to demonstrate yoga techniques for stress management. He's first going to show the standing forward bend, And on the exhale, he's going to draw the front of the torso out of the groin and open the space between the pubis and the top sternum. As in all the forward bends, the emphasis is on lengthening the front of the torso. If possible, with knees straight, bring the palms or the fingertips to the floor slightly in front or beside the feet, or bring the palms to the back of the ankles. If this isn't possible, cross the forearms and hold the elbows. Press the heels firmly onto the floor and lift the sitting bones towards the ceiling. Turn the top thighs slightly inward. With each inhalation in the pose, lift and lengthen the front torso just slightly. With each exhalation, release a little more fully towards the bend. Next, Marcos is going to demonstrate the standing half forward bend. From the standing forward bend, press the palms or the fingertips onto the floor beside the feet. With an inhale, straighten the elbows and arc the torso away from the thighs, finding as much length between the pubic bone and navel as possible. With the palms or fingertips, push down and back against the floor and lift the top of the sternum up away from the floor and forward. The knees might need to bend slightly to help arc the back. Look forward, but be careful to not compress the back of the neck. Hold the arched back position for a few breaths. Then, with an exhale, step back to a high plank pose and to a lower plank pose. Firm the shoulder blades against the back ribs and press the tailbone slightly towards the pubis. Next, Marcos is going to demonstrate the low plank. There is a tendency for this pose for the lower back to sway towards the floor and the tailbone to poke up towards the ceiling. Throughout the stay in this position, keep the tailbone firmly in place and the legs very active and turn slightly inward. Keep pressing the ball of the foot to the floor, especially under the big toe and the baby toe. Draw the pubis towards the navel and keep the space between the shoulder blades broad. Do not let the elbows splay out to the sides. Hold them in by the sides of the torso and push them back towards the heels. Press the bases of the index fingers firmly to the floor. Lift the top of the sternum and the head towards to look forward. Next, Marcos is going to do the upward facing dog. He's going to inhale from the low plank, press the inner hands firmly onto the floor and slightly back, as if you were trying to push forward along the floor. He's going to straighten the arms and simultaneously lift the torso up and the legs a few inches off the floor on the inhalation. Keep the thighs firm and slightly turned inward, and the arms firm and turned out so that the elbows creases face forward. Press the tailbone towards the pubis and lift the pubis towards the navel. Narrow the hip points. Firm but don't broaden the buttocks. Firm the shoulder blades against the back and puff the side ribs forward. Lift through the top of the sternum but avoid pushing the front ribs forward, which only hardens the lower back. Look straight ahead or tip the head slightly back, but take care not to compress the back of the neck and harden the throat. Next, Marcos is going to demonstrate the downward facing dog. From the upward facing dog, exhale and lift the knees away from the floor. At first, keep the knees slightly bent and the heels lifted away from the floor. Lengthen the tailbone away from the back of the pelvis and press it slightly towards the pubis. Lift the sitting bones towards the ceiling and from the inner ankles, draw the inner legs up into the groin. Push the top of the thighs back and stretch the heels onto or down towards the floor. Straighten the knees, but be sure not to lock them. Firm the outer thighs and roll the upper thighs inward slightly. Firm the outer arms and press the bases of the index fingers actively onto the floor. From these 2 points, lift along the inner arms from the wrists to the tops of the shoulders. Firm the shoulder blades against the back and then widen them and draw them towards the tailbone. Keep the head between the upper arms. This pose should be held for at least 3 to 5 long, deep breaths. Next, Marcos is going to demonstrate the mountain pose for someone that has an adaptation which affects their physical disability and lowers or weakens their lower extremities. He's going to lengthen the tailbone towards the floor and lift the pubis towards the navel. Press the shoulder blades onto the back and then widen them across and release them down back. Without pushing the lower front ribs, lift the top of the sternum straight towards the ceiling. Widen the collarbones. Hang the arms beside the torso, balance the crown of the head directly over the center of the pelvis, with the underside of the chin parallel to the floor. Throat soft and the tongue wide and flat on the floor of the mouth. Soften the eyes.